It is my great pleasure to be with you today in the integrative conference around the world in Portugal. Thank you, Dr. Anna, for your kind invitation. I'll be sharing with you very shortly my slides, and we will be talking today about the integrative approach of anti-aging and regenerative medicine. This is Dr. Sahar Lashin. I practice in California, USA, and I have the American Board of Internal Medicine, followed that with the American Board of Anti-Aging and Integrative Medicine. And it was also great to complement the regenerative approach from the American perspective with the Swiss Biological Medicine Academy in Switzerland, and share in there a lot of experiences with great doctors from all over the world, just like we're doing right now. I also work in Newport Beach. I have my own clinic, and it is an anti-aging and integrative medicine as well. I do have a consultation position with Body Logic MD, which is a franchise all around the US in hormone replacement and in biological integrative medicine. Previously, I worked as an assistant professor in UCLA and held a lead physician in the internal medicine department. Before that, I did have an associate medical professor position in GI hepatology and tropical medicine department in Cairo University, where I taught medical students for 18 years. And I continued that in UCLA as well, until I shifted totally to the integrative medicine. In our search for fountain of youth, we did discover that in the bioidentical hormone replacement and our approaches dealing with our patients with the biological holistic approach. People have been trying to find this since a long time. It might have been a myth, but I think now the myth is more reality by the lot of achievements in the medical field, which has happened in the last 10 or 20 years. Few decades, big change in the way we think about cells, about metabolism, mitochondrial health, all over general health, how to prevent the problems. And Herodotus went to Florida to find the fountain of youth, and that's the pathway of the fountain of youth, and I went there too. So the main theme about aging is our hormones. We age because our hormones decline. It's not that hormones do not decline because we age. It's about we losing the hormones, and that's why we get older. So in general, as an integrative biological medicine doctor, we usually address the root of the disease, not just the symptoms. We prevent the disease. We maintain the healthy young people inside out. We don't wait for disasters to happen so we can interfere. We prevent disease recurrence, and it's the best proactive approach in the medical field. Traditional medicine, on the contrary, wait for the problems to happen, and then they interfere by a pill or by a chemical that have tons of side effects. And at the end, it's just masking the problem. Men and women are left to live half of their lives without the ideal or adequate level of hormones. And why? Because we knew a little about what's going on. Most of the traditional doctors would say for menopause, well, try to live with it. Otherwise, the hormone's gonna give you cancers. Yet nobody knew that later on in life, we will have bioidentical hormones that can provide the new fountain of youth for long time. We can look young, we can feel young, we feel healthy, and the health will reflect in our looks inside out. So when patients come to me in the clinic, the range of ages can be anything between 30, 40, 50, 60, or even 70, even older than that. And if they are aging, their hormones are aging before they do. So what are the symptoms that they will suffer from? How can we recognize this early on? Since the earlier we interfere, the better it gets, and for longer time, they become healthier more and more. So why hormones are so important to be balanced? Well, hormones are like a symphony. They all interact. There is a lot of feedback, negative and positive feedback, a lot of adjustments, and we need all this for our bodies to adjust on every second basis, every day in our lives to function on the best way. It includes so many of the hormones. It can be testosterone, estrogen, progesterone, DHEA, cortisol, growth hormone, melatonin, thyroid, oxytocin, and many more. So if we think about how the patient gonna feel having the estrogen weaning off with the perimenopausal or the menopausal time, they start having memory problems, insomnia, they can't sleep with all these hot flashes, night sweats. I have a patient who told me, I had 40 night sweats and hot flashes at night. I can't sleep more than 2 hours and they are interrupted sleep. Consequently, they start to have anxiety, depression, they start to have high cortisol, they start gaining weight, migraine headaches can happen, a lot of mood swings, not having any time to lie down or sleep and regenerate. They start to have frequent UTIs. And of course, loss of libido and sexual dysfunction kicks in. The muscle mass start to be lost,